This is Dr. David Drozik, welcoming you to the Lifestyle Medicine Clinic. Are you ready for health? In this session, we're going to talk about gastroesophageal reflux disease, or GERD. You can find more information on our website, so if you're finding us on YouTube, I'd recommend you go to the lifestylemedicineclinic.us, go to the Learn More tab, scroll down to the Get Rid of GERD section to find some additional information that might be helpful. What causes GERD? Well, let me give you a brief anatomy lesson. Over here on the left, we have a normal stomach, and this is the esophagus, the tube that brings the food down from the mouth to the stomach. And you'll notice this thin pink line, which is the diaphragm, the muscle that helps us breathe, that separates the chest from the abdomen. Normally, the last 2 centimeters, almost an inch of the esophagus, is below that diaphragm. And that's important because in that last 2 centimeters, there's a valve-like effect called the lower esophageal sphincter that helps tighten up after you've eaten to keep the food down in the stomach where it belongs. People with GERD have a dysfunction in that sphincter, which allows the food to come back up into the esophagus and cause damage or that sense of burning. Some people also have a hiatal hernia. Now you can have GERD without a hiatal hernia. You can also have a hiatal hernia without GERD, but the two oftentimes go hand in hand. So what happens with a hiatal hernia is part of the stomach actually gets pushed up through that diaphragm into the chest. And that leaves that last portion of the esophagus above in the chest, so that every time you take a breath in, you have a negative pressure, which opens up that valve and can help draw up the contents of the stomach, like a straw drawing up a drink of water when you suck on it. So the symptoms of GERD are heartburn, that sense of burning sensation in the chest, water brash, which is hot liquid coming up into the back of your mouth, bad breath, sour taste in the mouth from the hot liquid that comes up, and less typically, people sometimes complain of chest pain, nighttime asthma, which is waking up short of breath because the food has come back up and gets sucked into your lungs, hoarseness from irritation of the vocal cords, and actually even damage to the teeth by the acid that comes back up. GERD can cause several complications, including scarring of the end of the esophagus from the burning of the acid, which can eventually lead to a blockage. It can also cause pneumonia or asthma symptoms because of the acid getting sucked into the lungs, and it can also lead to esophageal cancer. What do we normally do about GERD? Well, generally, we treat it with pills to cut down the acid secretion or to tighten that sphincter muscle at the end of the esophagus, or even to help your stomach empty quicker. And sometimes we do surgery to help correct a hiatal hernia or to tighten up that sphincter muscle. How well do these actually work? Well, they work to a degree. However, when you start taking pills and having surgical procedures, you are putting yourself at increased risk. Surgery has unintended consequences. That worst case scenario can cause death, and many of our pills cause problems. For example, the proton pump inhibitors that we've been using for years now to help decrease acid secretion have actually been implicated in helping accelerate osteoporosis, that softening of the bones. They also interfere with the absorption of other medications. They increase the risk of certain kinds of infections, contribute to chronic kidney disease, and even dementia. So it might be a good idea to try to avoid medications and surgery if there's another option, which exists. A paradigm we'd like to use in lifestyle medicine is that of a sink that is clogged, the water's running, and the water's running over onto the floor because of the clogged drain. What we do in modern medicine is we mop up the floor with our pills and our procedures. What we do in lifestyle medicine is go back to the cause and take care of the cause, which is the running water and the clogged drain. So do you want management of the results of the problem, or do you want reversal of the disease? Many years ago, Thomas Edison said the doctor of the future will give no medication, but will interest his patients in the care of the human frame, diet, and in the cause and prevention of disease. And that's what lifestyle medicine does. I would encourage you to look at our entire website to see the modalities of lifestyle medicine, which include a diet focused on plants, physical activity, stress management, control of unhealthy substances, healthy sleep, and meaningful relationships. Well, what can we do specifically for GERD with lifestyle medicine? Well, we can help with weight loss. We can help control those dietary factors that lead to GERD symptoms. And we can also help with those lifestyle factors such as tobacco, caffeine, and timing of the meals. For GERD, as in most chronic lifestyle-related diseases like cardiovascular disease and diabetes, that fork is the most important determinant of your health unless you smoke. And if you smoke, stop smoking and then concentrate on what you eat. We encourage our patients to eat more to the right, eat more plant-based whole foods, less of those animal products and processed foods. And I would refer you to our first 2 sessions to help you understand that better. We encourage our patients to eat at least 3/4 of their plate full of foods that are high in fiber and water. These are foods that are rich in these healthy phytonutrients, and they're very low in calories and low in fats. And fats are one of the things that are implicated particularly in GERD. So specific causes of GERD include overweight and overeating. That increased weight actually causes increased pressure on your stomach, which helps push the food back up through the esophagus. It also helps increase the risk of that hiatal hernia through that increased pressure. And foods that are high in fat, especially animal fat, cause a relaxing of that sphincter muscle, letting the foods reflux up into the esophagus. Other causes are caffeine. So switch to decaffeinated beverages if you can, and certain medications are implicated as well. This whole class of drugs called NSAIDs, which include aspirin and ibuprofen, naproxen, which are over-the-counter. Diclofenac is another one. You can look those up online and see if you're taking one. Also muscle relaxants and medications to help with depression and anxiety, as well as many other medications. And as we mentioned, sometimes the hiatal hernia is also implicated. There are things that make GERD worse, that increased intra-abdominal pressure. For example, women who are pregnant tend to have lots more heartburn because they have something pushing up on their stomach from down below. However, chronic constipation, which is due to a low-fiber diet, causes that increased intra-abdominal pressure as well, and actually is implicated in things such as causing the hiatal hernias, pushing that stomach up into the chest from straining. Also can be a factor with hemorrhoids and varicose veins. And then sometimes the stomach empties poorly, which is influenced sometimes by the foods you eat as well as by diseases like diabetes. Other things like tobacco cause a relaxation of that sphincter muscle. Alcohol causes a burning sensation because it hits contact with the raw surfaces. Acidic foods like tomato products and vinegar also cause that burning sensation. They don't actually cause the GERD, they just make you aware of it. Like if you had a cut finger and you stuck it in some alcohol or vinegar, you would feel it burn. It's the same kind of thing going on in your esophagus. And then chocolate and mint tend to cause a relaxation of that sphincter as well, so you might want to watch those. What are the treatment options for GERD? Well, the American Medical Association says that lifestyle medicine intervention should be the first and primary mode of preventing and, when appropriate, treating chronic disease within clinical medicine, and that indeed is the case for GERD. We want you to think of food as medicine. Then you ask, what's the dose? Well, the dose starts with a plant-based diet. which will automatically be low in fat. You want to avoid those animal fats in processed foods, things like dairy, cheese, meats. The size of your meals are also helpful in controlling GERD. Actually, if you eat several smaller meals a day rather than one or two large meals, you'll be less likely to have heartburn, and you want to avoid that big heavy meal in the evening. You want to front load and eat most of your calories earlier in the day. You want to especially avoid eating within a couple hours of lying down, because once you've eaten that food, it stimulates acid, and if the valve's not working and you lay down in bed, the acid sloshes right back up in the esophagus and causes the damage. You also want to consider elevating the head of your bed, but not on pillows. Actually, using pillows may make it worse because you tend to bend in your abdomen, which causes increased pressure and forces more of the food up into the esophagus. So what you can do is get a wedge that goes all the way down to your waist. However, some people tend to slide off of those. A better way would be to elevate the entire bed under a couple of blocks or a couple of bricks. Then you want to make sure you don't have real slippery sheets or you'll be sliding down during the night. But that's a helpful way to keep the food down in your stomach, just utilizing gravity. You want to decrease your caffeine and alcohol intake and eliminate that tobacco. And you want to lose weight if you're overweight. Begin to be more physically active. You can do things like stand while you work if it's possible. Take the steps instead of the elevator, park further away in the parking lots. Make yourself do physical activity. We have a whole session on physical activity to give you some options. If you've got bad knees or bad hips, you still can do physical activity. So I encourage you to watch that session. So what's the dose? If you're able to walk, you want to be walking at least 30 minutes a day or working up to 10,000 steps a day on a pedometer, and that's just a good starting place. Another thing that may be helpful is to exercise just at 10 minutes after each meal. It helps decrease the weight you may gain from eating and then sitting. Lifestyle medicine treatment of GERD is inexpensive. It actually decreases your food costs and decreases your medical costs. And there's no negative side effects other than maybe a little bit of gassiness that first couple of months while you adjust to the high fiber foods. Lifestyle medicine treatment has many beneficial side effects in that one diet treats all these chronic lifestyle related diseases like high blood pressure, high cholesterol, diabetes. It helps prevent stroke, helps prevent heart attacks, helps prevent many of our cancers, and it puts you in control. If your underlying GERD problem is related to poor stomach emptying, then ginger can be helpful. If not, ginger may actually make things worse. So you can give it a try and see what happens. It's very inexpensive. Ginger tea, ginger capsules are both options for you. And then you want the Gaviscon type antacids. Alginic acid and bicarbonate is the main ingredient of those. You want to avoid the aluminum and magnesium antacids. And you especially want to avoid the calcium antacids, which actually make the problem worse. The Gaviscon type antacids put a protective coat on top of the food, so when the food does reflux, it helps coat and protect the esophagus. So if you don't change direction, you may end up where you're heading with complications of GERD. We want to empower you to make healthy choices to avoid problems with GERD. I would encourage you to look at the side of our website and download a copy of the goals. You can set some SMART goals. Here are some examples, such as avoid reclining for 2 hours after eating on 5 days a week, or eat a smaller portion for the last meal of the day on 5 days a week, avoiding animal products, especially those that are high in fat, and switch to decaf coffee. You choose the ones that work best for you. Feel free to contact us if you have any questions.